Hey everybody, it's Alex with CareConscious.com. Today I'm speaking with Karen Selby. She is a registered nurse and the patient advocate at the Mesothelioma Center. Did I say that right, Karen? Mesothelioma. Mesothelioma. Mesothelioma Center at asbestos.com. And Karen, can you tell us a little bit about what's asbestos.com all about and what are you doing there?
Sure, absolutely. Asbestos.com is actually a website that provides, it's a free resource on the internet for patients and families that are experiencing any type of concern of asbestos-related diseases or a new diagnosis. People get on the internet, they Google search what is mesothelioma, and our site may pop up, and it just is an introduction as to what this disease is and what these patients may be experiencing. And it's just a free help center, a free resource. Now, I work for the Advocacy Center that it works in conjunction with that website. The nurse here on staff, we have several patient advocates that play different roles here with regard to many aspects of the disease. Oftentimes, a patient may go to get a CAT scan because of difficulty breathing, and the doctor says, well, there's some concerns on your CAT scan. We want to run some more tests. Oh, well, what kind of concerns are we talking about? Well, we may have a concern of mesothelioma. Have you worked around asbestos? So, of course, these patients get on the internet because they have no idea what this disease is, and it's just a resource for these patients to help them understand what this may be, what to expect, and what their journey is going to be like in the future.
Right. Thank you for explaining that. And as you know, we're all about the family caregiver. We're about the person taking care of the person with an illness or condition or just a frail individual. And I'm curious, what's caregiving like in the situation of mesothelioma? What you said earlier, we were talking before the call, that mesothelioma it's a very short-lived illness. Do caregivers even have a chance to come into the role of a caregiver? Do they understand, hey, I'm actually a caregiver now? Can you talk a little bit about that?
Absolutely, sure. When we talk about life expectancies with after a diagnosis is made, it typically is a fairly aggressive, fast-moving cancer. Not all the time, but the life expectancy of a patient diagnosed with this disease is about 12 to 16 months. So it is rather quick. However, certainly I keep in touch with patients that outlive that. So absolutely, there is a role for a caregiver, and these patients definitely have some emotional concerns. Certainly when a physician tells them that you are diagnosed with a cancer that there is no cure for, it can be very overwhelming for them. Of course, there are treatments for these patients, but treatment is more palliative than anything. And oftentimes these patients have to make a decision. Do I even want to go through palliative care, knowing that there is no cure for this disease? And when we talk about palliative care, what are we talking about? Primarily we're talking about radiation and chemotherapy. That's going to do nothing other than help prolong a life or make some of the symptoms a little less severe. But of course, the downside is they have to deal with the side effects of the kind of treatment they're going to be having. So a lot of emotional support these patients are going to need from the caregiver to help them, number one, with the decision making, and number two, with post-treatment of what they're going to have to be experiencing with that treatment if they choose to go that route. So yes, there's definitely a big need for the caregiver to, I guess, understand that these patients are going to need a lot of emotional support to help them through that process.
So the patients are going to need a lot of emotional support. The caregiver is going to need a lot of emotional support. Can you say a little bit about that?
Yes, and I'm glad you brought that up. It is. It can be very emotional for that caregiver, or that spouse, or that child that is dealing with a parent that is dealing with this disease. And yes, and as you know, being the role that you play, they have to really focus on their own support and their own needs when dealing with the patient. And one thing that, and I'm sure you provide, one thing we do provide is support for those family members. And we also provide resources here too to help them get connected with others. And I find a lot of family members and support givers are asking for, how do I get connected with somebody that's dealing with what I'm dealing with. I can find someone that's dealing with breast cancer. I can find somebody who's dealing with liver cancer, but I have specific questions, and I would like to be able to connect with others that are dealing with exactly what I'm dealing with as a support network, or even to answer questions. As a nurse here on staff, that's kind of what I do as far as answer the medical questions. And sadly, I get faced with those questions of, okay, what am I supposed to be looking for? How do I know, when the time is coming, or, how do I know when to get hospice involved? How do I know when the disease is transitioning? So oftentimes I spend a lot of times counseling these patients, and often helping them get connected with the right person to help answer those questions. And there's some various online support groups specific to mesothelioma. So I try to help the support network get those answers that way.
Right. And you said mesothelioma is relatively rare. It's a rare form of cancer. Is that correct?
Less than 1/2 of 1%, less than 1/2 of 1% of all cancers is mesothelioma. So just to give an idea of how many diagnoses per year in the U.S. are a type of cancer. I mean, this is an extremely rare type of cancer.
But it is very specific, and its course has a very specific trajectory, and it seems to be pretty. I mean, it's extreme. It seems, it must come as a big shock.
It is extreme. It is. I guess the good part is it is rare, but it is extreme. It is specific to we kind of know what it's going to do. It typically does the same thing every time. It's not a mystery. Although medicine is not a perfect science, we kind of know what this disease is going to do. It kind of travels the same path. Typically for every patient, so we kind of know what the cancer is going to do, sadly. And it is specific to, and this is, almost, it's very unique, where this disease is only caused by asbestos. There's no other way to get mesothelioma, so it's very specific to an environmental exposure. So it's kind of the next question that a physician would ask a patient is, how did you get this cancer? Because it's typically always occupational related, typically.
Right. Well, Karen, I really appreciate your insights, and I hope that this video shows individuals looking for information about asbestos, or caregivers on our site, that hey, there are mesothelioma caregivers out there. Mesothelioma caregiving is part of coping with mesothelioma. Absolutely. And support is available. You're there. Asbestos.com is there, and that's awesome. And
and I mean, obviously your organization is phenomenal too, and it can be something that I can direct these patients to as well, because it's pretty much all I do is connect with. And you kind of mentioned it when you said that when you're diagnosed with a disease, it's the caregiver is usually the primary person playing the role. So the majority of patients that I connect, or the majority of people I connect with, is not necessarily the diagnosed, but that son, that wife, that friend that is looking for resources and looking for answers to help these patients through their journey.
Right. Well, thank you so much. We'll spread the word, and I'm just really impressed with what you guys are doing.
Thank you, Alex. It was a pleasure to meet you.
All right. You too. Take care.